So questions often arise as to which is the best position to sleep in at night time, and the honest truth is there is no best position to sleep in, and the right thing is what's right for you. So if you feel comfortable, you feel that your sleep is sufficient for you in quality and duration, and you wake up feeling refreshed, then that's the right position. There's of course more factors that go into that equation, particularly bed partners. They may well give you a nudge in the ribs if you're snoring. And we know that snoring is worse when you are lying flat on your back. And the reason for that is when you're asleep at night, all of the muscles in the neck relax and the airway becomes floppier. When it vibrates at night time, that's what snoring is. And of course, if the tissues at the back of the throat are too relaxed, it can close off your breathing completely. And that's something we call sleep apnea. Or stopping breathing at night, which we all do to some degree, but it's when that happens too frequently that it can disrupt your sleep. So generally, if you have sleep apnea or if you're a loud snorer, lying on your back is probably not the best position. And of course, trying to position yourself when you're asleep can be difficult. So pillows to prop yourself up. And some people even attach things to the back of their pajamas to stop themselves from lying flat on their back. Generally, lying on the side is the preferable option that people choose, and that's sensible from the perspective of the upper airway. Also, if you are prone to reflux, so a little bit of acid coming up and irritating the back of the throat, that tends to happen less often if you're either on your back or your side, compared to if you lie flat on your front, which some people choose to do. It is purely preference. I tend to tell people I see in clinic to avoid that if they can, just because it can cause a bit more reflux. The neck is generally out of line with the spine, and that can cause problems with wear and tear in the neck. But personal preference is the key, unless there's other conditions to be considered.